Hello guys, welcome back to my channel. If this is your first time here, welcome. Please kindly join the family by clicking the subscribe button and turn on the notification bell so you'll be the first to get notified whenever I drop a new video. And if you are a returning subscriber, welcome back. It's been a long time. I've missed you guys so much, but now we're back and better. So in today's video, I would like to share with you the causes and the solution to painful intercourse. So if that sounds like what you want to know, because I know that's what you want to know, so you definitely have to keep on watching. Painful sexual intercourse is medically termed dyspareunia, which is the pain you feel around your genital area and within the pelvic area during sexual intercourse. This pain can be intense or sharp. Now let's talk about the causes. The causes are of two types, the physical cause and the emotional cause. But the physical cause is also subdivided into two, which is the deep thrusting pain and the entry pain. The entry pain is the pain you feel when penetration is about to start, when it has not getting to you when it's about to start. And that's also we'll be discussing on this video. I'll discuss the physical pain and also the emotional pain. So now let's get started. Not enough lubrication. This is as a result of not enough foreplay. When the guy and the lady do not engage in sufficient foreplay that can bring about this wetness, quote unquote wetness, that's what we all know it. So wetness of the female, there might not be smooth intercourse because the entry will be difficult. You know, she's dried up. And during childbirth, immediately after childbirth, during breastfeeding, and when you get to your menopause stage as females, there is a drop in the level of estrogen, which can lead to dryness during intercourse. Some certain medications are known to affect sexual desire in men and women, and it affects the lubrication. Drugs like antidepressants, high blood pressure, sedative, ulcer drugs, all these drugs, some of these drugs have side effects that can affect sexual arousal. Injury, trauma, and irritation. Injury can be as a result of pelvic surgery, it can be as a result of female circumcision. And during childbirth, when the baby's head is too big, is bigger than the vagina hole, let me say the vagina, there is a procedure that is used, which is called the episiotomy. That is this thing we all call tear. So when this tear is not given enough time to heal up after childbirth, it can lead to painful sexual intercourse. Infection can cause painful intercourse. See, I have a full video about the cause, the treatment, the symptoms of infection. You know, infection and inflammation comes hands in hands. Inflammation is just like something, a reddish stuff that has this whitish spot. And you know, when this thing is inflamed, this part is inflamed, and another thing is coming in contact with it, it can cause pain. It can cause pain. So when you have inflamed pelvic area, when your pelvic area is a bit inflamed and you are engaging in intercourse, it can lead to pain during the procedure. Okay. Also, skin disorder like eczema can cause painful sexual intercourse. Vaginismus, this is the spasm of the muscle of the pelvic. Spasm is contraction. Just imagine something that is supposed to be like this is now like this. What's supposed to pass through it won't pass through it smoothly. It will pass through it roughly, and it can lead to pain. We have some problem at birth. Some people have perforated hymen, while some do not have a completely formed vagina. This thing can lead to pain. Now let's move to the deep pain. The deep pain is just a condition when the pain is felt from inside the body, is not outside. Now you just feel the pain is coming from inside, and it can be as a result of certain illness and condition, which involves hemorrhoids, which involves fibroids, it involves pelvic inflammation, it involves pelvic surgery, ovarian cysts. We have cancer of the uterus, uterine fibroid, I mentioned that earlier, endometriosis, and many more. There are some certain illness. All the certain illness can cause pain from within because it's something that I'm not seeing. It's a malfunction inside the body that can affect your sexual performance. Surgeries and medical treatment. History of surgery can lead to pain during sexual intercourse, like hysterectomy. We have medical treatments from cancer, radiation, and chemotherapy. So that's that about the physical cause of painful intercourse. Now let's move to the emotional cause. Before the emotional cause, let me just chip this in. There are also some other factors that affect pain during intercourse that I can associate with the physical cause, and that's overexcited partner, change in sexual behavior, vulvodynia. Guys, I forgot to add the definition of vulvodynia. Vulvodynia is a condition that causes chronic pain in the vulva area, and you know the vulva area to be that opening that you're always advised to rinse with water before you get to your vagina itself. It plays in the frequency of STDs. I'm going to explain that later. So, but before then, let me move to the emotional factor. Emotional factor has a very high role to play in intercourse, during intercourse, because it is intertwined between, you must be happy, like you must be in the mood before having intercourse, right? So someone that is just sad, you can't just expect the person to have a smooth intercourse. So I'll be talking about the emotional cause of painful intercourse. The first one is abusive partner or history of sexual abuse. When you have an abusive partner, that we have some people who can't have sex smoothly, like responsibly. Some will have sex by eating their partner or doing all sorts of things, and other people that have been raped, females that have been raped or that have been sexually molested, can get scared when they're about to have sexual intercourse with their partners. Also stress. When you're stressed up, the pelvic floor seems to contract. That's what I explained when I was saying vaginismus. When it contracts, there will be pain during intercourse because it's supposed to be relaxed. Okay, depression. Someone that is depressed can't be in the mood for sex, and that can lead to sexual intercourse and pain during sexual intercourse. Concerned about physical appearance. You know, someone that has key leg can be concerned about how his or her part. Okay, I'm talking basically about pain during sexual intercourse in female. So the person can be concerned about how a partner is going to see it. You know, the focus will be on the leg, not on the action itself. So it can lead to pain because you are not focusing on what you're supposed to focus on. Also, the first timers, as first timer, you don't know what you expect. You have to take it easy because, you know, someone that is having it for the first time, you don't know what to expect. You don't know what's really happening, what's going to happen. So you should take it easy. Once you know the solution, the problem, you have to know the solution. The first solution is see a therapist. If you're an abusee, that is, if you've been abused, see a therapist. If you don't have the confidence to fight the fear, then you should see a therapist that can help you in fighting the fear. If you've been abused or if you have an abusive partner, then you should see a therapist that can help you fight the fear by counseling you. The second one is engage in enough foreplay so as to increase the rate of lubrication. Like when there's enough lubrication, there won't be pain during sex, because if it's not associated with any medical term, because not enough lubrication causes vaginal dryness. Like the vaginal area will be dry, and once it's dry, there will be pain during intercourse. See your doctor. See, when you know all these things, like if you feel you don't engage in enough foreplay and now you engage in enough foreplay but you still feel pain during sexual intercourse, then you have to see your gynecologist, because it can be as a result of some medical condition that you don't even know. And all these things I mentioned, like the ovarian cysts, the hemorrhoids, the endometriosis, they all have cure. They can be treated. They are not terminal disease. They can be treated. So make sure you see your doctor so you can be diagnosed. There are so many things they can do. You can do urine culture, vaginal swab, and all those things. Make sure you see your doctor. And the last one I'll add to is, I believe in talking, not sulking. If you have a partner that has this change in sexual behavior, you should call him to order. I saw something on Instagram when this person was talking about this pornography sex, that it's not ordinary. Like, it's not that they are doing this thing with that motion they are bringing out to us.
Sex that's shown in porn is violent, it's not natural, it's too fast, it's too almost sexist, man. Real sex is slow and romantic and subjective. It's based on the equation that the two people share. It's based on the two people's personalities. And porn is almost never a good representation of great sex. We promote a lot of nofap on this channel. Trust me, as a guy, nofap will improve your sex life heavily. Nofap means no masturbation. Especially if you're in a relationship, practice nofap. See it affect your sex life well.
If you're someone who watches this thing and you want to carry out the experiment on your wife, I think it's bad, and that's a selfish behavior. So if you notice the change in your partner's sexual behavior, or your partner is someone who now drinks, and once he's drunk, he does not know what he's doing, or he just handle you roughly, I think you should just sit him down and let him know. Overexcited partner, these are people who maybe it's been a long day, have sex, and now they are very, very anxious. They just want to have it. They are not concerned about the female. They just want to go in. Okay. Increase in sexual transmitted disease when there is infection and the rate at which it is deposited in the body is high. It will give room for pain during sexual intercourse, because infection is even a discomfort, so it gives room for pain during sexual intercourse. That's basically all for this video. I hope you guys enjoyed it and I hope it was helpful. Please kindly give this video a huge thumbs up, comment, drop a thought down in the comment section, and please don't forget to subscribe to my channel. Also share this video. Don't assume people are enjoying their sex life. Share this video, save a brother's marriage, save a sister's marriage, and please don't forget to watch all my previous videos. Then I'd love to see you next time. Bye.